Hi everyone. Today we are going to discuss about national nutritional programs in India. I am Sasi, working as an assistant professor in Tribhulam College of Nursing. Let me see some of the objectives under this program. The students is able to understand the list of national nutritional program, narrate objectives of national nutritional program, list the services provided by National Nutritional Program. Introduction. India is one of the fastest growing countries in terms of population and economics, sitting at a population of 1.342 billion and growing at 1.5% to 1.7% annually. The Government of India have initiated several large-scale supplementary feeding programs aimed at overcoming specific deficiency disease through various ministries to combat malnutrition. National Nutrition Program. Here we have list of National Nutrition Program. Let me see. The first one is Applied Nutrition Program, Integrated Child Development Service Scheme, Special Nutrition Program, BALWADI Nutrition Program, National Nutritional Anemia Prophylaxis Program, Iodine Deficiency Disorder Control Program, Vitamin A Prophylaxis Program, Midday Meal Program, Midday Meal Scheme. The first program is Applied Nutrition Program. The Applied Nutrition Program was introduced as a pilot scheme in Orissa in 1963. Later, it is extended to Tamil Nadu and Uttar Pradesh. It is maintained by Ministry of Rural Development. During 1973, it was extended to all the states of our country. The main objectives under these programs are promoting production of productive foods such as vegetables and fruits, and ensure their consumption by pregnant and lactating mother and children. The main beneficiary comes under these programs are children between 2 to 6 years, pregnant and lactating mothers. Major components covered under this program are nutritional services, health services, communication, monitoring and evaluation. The services which is provided by these programs are, it provides nutritional education, nutrition worth of 25 pies per child per day and 50 pies per woman per day are provided for 52 days in a year. The nutritional education was the main focus and efforts were directed to teach rural communities through demonstration how to produce food for their consumption through their own efforts. And poultry farming, horticulture, beekeeping, kitchen gardening and nutrition education were the main activities in the program. The next program is Integrated Child Development Service Scheme. Integrated Child Development Service Program was launched on 2nd October 1975 under 5th Five-Year Plan in pursuance of the National Policy for Children. The workers at the village level who deliver the services are called Anganwadi workers. They will be supervised by the Mukhya Sevakas. Each Anganwadi unit covers a population of about 1000. This is one of the world's largest and most unique program for early childhood development and providing preschool education on one hand, breaking the vicious cycle of malnutrition, morbidity, reduced learning capacity and mortality on other hand. Objectives under this program are to improve nutritional and health status of children in the age group of 0 to 6 years, to lay the foundation for proper psychological, physical, and social development of the child. To reduce the incidence of mortality, morbidity, malnutrition, and school dropout. To achieve effective coordination of policy and implementation in various departments to promote child development. To enhance the capability of the mother to look after the normal health and nutritional needs of the child through proper nutrition and health education. Beneficiaries which is covered under these programs are children less than 3 years, children between 3 to 6 years, pregnant and lactating women, women in the reproductive age group 15 to 44 years, adolescent girls 11 to 18 years. The package of services provided by ICDS are supplementary nutrition, vitamin A, iron and folic acid, immunization, health checkups, referral services, treatment of minor illnesses, nutrition and health education to women, preschool non-formal education, convergence of other supportive services like water supply, sanitation, and early child care and preschool education, growth promotion and supplementary feeding. Supplementary nutrition, child up to 6 years of age, he should take 300 kilocalorie and 8 to 10 grams of protein. Adolescent girls 500 kilocalorie and 20 to 25 grams of protein. Pregnant woman and lactating mother 500 kilocalorie and 20 to 25 grams of protein. Malnourished child 600 kilocalorie and 16 to 20 grams of protein. Next program is Special Nutritional Program. This was started in our country in 1970-71 by Ministry of Social Welfare in operation in urban slums, tribal areas and backward rural areas. This program was operated under Minimum Need Program. The main aim is to improve nutritional status in targeted group. The beneficiary groups are children below 6 years, pregnant and lactating women. Services which is provided under these programs are provide supplementary feeding for preschool children, 300 kilocalories and 10 to 12 grams of protein per child per day, pregnant and lactating mothers 500 kilocalories and 25 gram protein daily, total 300 days in a year. The supplement is provided to the beneficiary. The program is gradually being merged into the ICDS program. Next program is BALWADI Nutrition Program. This program was started in 1970 for the benefit of children in the age group of 3 to 6 years in the rural area. It is under the overall charge of the Department of Social Welfare through voluntary organization. BALWADIs also provide pre-primary education to children. Beneficiary group preschool children 3 to 5 years. Services which provided under this program, it provides 300 kilocalories and 10 grams of protein for 270 days in a year. Also provide preschool education. Funds for the supplementary feeding of BALWADI Nutrition Program is given by the Indian Council of Child Welfare. The next program is National Nutritional Anemia Prophylaxis Program. Nutritional anemia is one of the major health problems affecting women and children in India. Recognizing the importance of prophylactic measures like supplementation with iron and folic acid to prevent the development of anemia, the National Nutrition Anemia Prophylaxis Program was launched in 1970. The program is based on daily supplementation with iron and folic acid tablets to prevent mild and moderate case of anemia. The beneficiaries are at risk group like pregnant women, lactating mothers and children under 12 years. The objectives: to assess the baseline prevalence of nutritional anemia in mothers and young children through estimation of hemoglobin level. To put those mothers and children with low the HB levels, it means less than 10 gram per deciliter and 8 gram per deciliter respectively, on anti-anemia treatment. To put the mothers with HB level more than 10 gram per deciliter and children with HB more than 8 gram per deciliter on the prophylaxis program. To continuously monitor the quality of the tablets, distribution and consumption of the supplements, and to periodically assess the HB level of the beneficiaries. To motivate and educate the mothers about the advantages of consuming iron and folic acid tablets. Next program is Iodine Deficiency Disorder Control Program. The National Guided Control Program was launched by the Government of India in 1962 in the conventional goiter belt in the Himalayan region. Recent surveys, however, indicated that the problem of goiter and iodine deficiency disorder was widespread than it was thought earlier, with nearly 145 million people estimated to be living in own goiter endemic areas of the country. As a result of major nutritional program, the National Guided Control Program was renamed it on 1992 as National Iodine Deficiency Disorder Control Program. The main objectives of the program were survey of goiter in the suspected area to identify endemic goiter area, production and supply of iodized salt to the endemic areas, resurvey after 5 years of continuous supply of iodized salt in the endemic areas to assess the impact of the program. The 4 essential components of these programs are iodized salt or oil, monitoring and surveillance, manpower training, mass communication. Next program is Vitamin A Prophylaxis Program. This program was launched in 1970 by Ministry of Health and Family Welfare at MCH centers in urban areas and primary health centers in rural areas. One of the components of National Vitamin A Prophylaxis Program for control of blindness is to administer a single massive dose of an oily preparation of vitamin A orally to all preschool children. The vitamin A is readily absorbed and stored in the liver, from where it is gradually released for utilization by the tissues. Objective of this program: reduction in the incidence of the problem, prevention of blindness due to vitamin A deficiency. The beneficiary groups are age group 6 months to 5 years. A single dose of vitamin A, 2 lakh international unit of vitamin A orally to all preschool children every 6 months through peripheral health worker. Next program is Midday Meal Program. It was first started in Tamil Nadu. It also known as a school lunch program. This was launched in 1961 by the Ministry of Education. Aim of this program: to provide at least one nourishing meal to school going children per day, to enhance the admissions and retain students in the school, to improve literacy, to improve the health status of children. Objectives of this program: improve the school attendance, reduce school dropout, beneficial impact on child's nutrition. The principles which behind this midday meal programs are: supplement and not to substitute to the home diet, supply at least 1/3 of the energy requirement and half of the protein needed. The cost of meal should be reasonably low. Meal prepared easily in schools, no complicating cooking procedures should be involved. Locally available food should be used. The menu should be frequently changed. The meal should be hygienic and quality. Midday Meal Scheme. Midday Meal Scheme is also known as National Program of Nutritional Support to Primary Education. It was launched as a centrally sponsored scheme on 15th August 1995 and revised in 2004. Some suggestions for preparation of nutritious and economical midday meals are: unrice, parboiled and unpolished rice should be used. It should be a single dish meals. cereal pulse combination, sprouted pulses, leafy vegetables, fermented food items should be used. Only iodized salt should be used for cooking midday meals. Take home message: nutritional anemia is one of the major health problems affecting women and children in India. In ICDS, child up to 6 years of age, 300 kilocalorie and 8 to 10 gram of protein should be taken. Adolescent girls, 500 kilocalorie and 20 to 25 grams of protein should be taken. And pregnant woman and lactating mother, 500 kilocalorie and 20 to 25 gram of protein. Malnourished child, 600 kilocalorie and 16 to 20 gram of protein. Reference: www.nutritionprograms.india.com. Thank you very much for watching my video.